புன்னகையில் புத்துச்சிருப்பேன் வானா தொரி பொறி தோம் தரனா சூரியன சந்திரனா புன்னகையில் புத்துச்சிருப்பேன் வானா.
Hi, I'm Joe Chetty. Catch me every Monday on a brand new show called Money Matters from 7 to 8 p.m. where we unravel the mysteries of money, offering expert insights and real-world tips. Start your week right, because when it comes to finances, we are not just talking rands and cents. We are making sense of your sense. Money Matters with me, Joe Chetty, every Monday from 7 to 8 p.m. only on Southside FM 107.2.
The information provided in Doctor's Corner on Southside FM is intended for general informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Listeners are strongly encouraged to consult with their qualified healthcare professionals, including their general practitioner, for personalized medical advice tailored to their individual needs. Any actions taken based on the information presented in the medical talk shows are at the listener's own risk. Medical decisions should be made in consultation with your licensed healthcare provider.
It's 7 p.m. Good evening to all and welcome to another live broadcast of Doctor's Corner on Southside FM 107.2, where we are discussing all things medical. You are with me, Dr. Prabhashini Kupsami. I am a general medical practitioner in private practice and I have a specialty qualification in aesthetic medicine. You will find me here every Thursday between 7 and 8 p.m. as I bring you cutting edge and up-to-date current information on relevant health topics. My aim, as you know, is to educate and empower you, my listeners, to take charge and take back control of your health, to improve, nourish and strengthen your body, mind and soul. Welcome to Southside FM 107.2. Last week, we had a chemical pathologist in studio discussing diabetes and basic screening laboratory investigations. If you missed that, you will find it on the Southside FM website and the Facebook page, as well as on YouTube. Today is World Kidney Day. And what better topic to feature on a medical show than prevention of kidney disease? So this week, we have a specialist nephrologist in studio. My guest today is Dr. Jay Mudley, and he's here to share some valuable insights into kidney disease and strategies to prevent progression to kidney failure on World Kidney Day. So stay tuned.
Bloody bugger.
Hey, bada mapla, pada pada topla, volleyball adalama.
Hey, aanu sakla, cycle gapla, kidku puri podalama.
Mukka kide, muttangodu,
Kadichu putta, katta kudade, mundanayil, putta katte,
mullu kuttum, raktam varade.
எப்படி
அப்படி அப்படி. Hey, bada mapla, pada pada topla, volleyball adalama. Come on, come on.
aanu sakla, cycle gapla, kidku puri podalama.
Come on, come on.
Don't angry me. Bad girl.
So today we are talking about kidney disease. Our WhatsApp lines are open for questions throughout the show, so make sure you send in your questions or your comments, as there will be a Q&A segment at the end of the show. The number to send it into is 074 345 4447. So you can WhatsApp us on 074 345 4447. You can also catch us live right now on Facebook on Southside FM South Africa and on YouTube Southside FM Doctor's Corner. It gives me great pleasure to welcome to the studio my friend and my guest for this week, Dr. Jay Moodley. Dr. Moodley, welcome to Southside FM, and thank you for coming through to share some of your invaluable knowledge, your expertise and management skills with the listeners of Southside FM.
Thank you, Prabhashni, and thank you so much for the invite. I'm really looking forward to the show. It's especially important and especially exciting because today is World Kidney Day, and also a very good evening to the listeners.
Dr. Jay Moodley is a specialist physician and a super specialist nephrologist at Life Mount Edgecombe Hospital in Phoenix and Busamed Gateway Private Hospital in Umhlanga. He has been in private practice for 11 years and has set up renal care facilities at both these hospitals. His special interest is in preventative nephrology. He works closely with general practitioners in the area, like myself, to detect and assist kidney patients early so as to prevent progression to kidney failure. So I've been trying to get Jay to come to the show since episode 1, and he has just been too busy, and the only reason he agreed today is because it's World Kidney Day and it's his time to shine. So
Thank you.
They say it's a beautiful thing when a career and passion come together. And I know your story, but I think it's also important for our listeners to know, besides just what a nephrologist is and what they do, it's just important for them to know who's behind the title and what drives this passion in their respective field. So tell us, Jay, why nephrology?
So, nephrology. So, I'm not sure if the listeners are aware, but a nephrologist is a doctor that actually treats the kidneys and kidney abnormalities. And for me, it's not just a job; it's a passion, and it has a very personal reference and a very personal history. So, I'm just going to give you a little bit of a background about myself. So I hail from Tongaat. I'm from Tongaat. And I studied at WITS. I came down to Durban to do my internship, my community service at Dundee. And I left South Africa to work in the UK for a few years. And while I was in the UK, my dad was diagnosed with kidney abnormalities and kidney problems, and he went on to dialysis in 2005. And obviously, it stimulated this huge interest for me in terms of nephrology and obviously patient care, and did a huge dive into nephrology. And it was logical for me to then pursue a career in nephrology. I came back to South Africa and I decided to specialize as general physician. And in South Africa, you cannot do nephrology directly like you can in the UK and other countries abroad. So I started off doing general medicine and then studied nephrology, and eventually, came out of it all after 15 years or so of studying. And it's actually a huge passion for me. And the thing that actually helps me understand my patients a lot better and a lot differently is the fact that when they say to me, "But doctor, you do not understand what kidney disease is all about," and I have to correct them, and I say, "But I do," and I've lived through it as both a patient, and I now obviously with work as a doctor. So I understand the difficulties, the challenges, and the huge sort of mental aspect associated with kidney disease and dialysis per se. So yeah, that's the reason I do what I do. It's a huge passion for me, and I think a job done with passion is not really a job. It actually brings such fulfillment in terms of patients' lives, communities, and your life. So yeah, that's me in a nutshell.
Brilliant. So about today is a special day in your world. It's World Kidney Day. So
Absolutely.
Tell us about that.
So
I noticed on your practice that you had a whole setup for World Kidney Day. You had a cake and everything.
So you know what? I think World Kidney Day has many different avenues of interest for different people. I think when it comes to World Kidney Day 2024, there's a piece that's actually been written about World Kidney Day from them in terms about what the reason for this is, and it's multi-pronged. And I think the biggest stimulus in terms of why World Kidney Day was actually created was awareness. I think the long and short of it is awareness, and the difficulties that the world faces in terms of awareness will be patient education. It will be healthcare policies, and where government actually puts in policies so that patients with these particular problems are being taken care of, being heard, and that the gravity of the situation is being properly assessed. Obviously, looking at facilities that are able to take care of them, and then train professionals, not just doctors, not just nephrologists, but you're looking at nursing staff, you're looking at clinical technologists, psychologists,
The
dietitians.
multidisciplinary
It
team
is
effort,
a
yes.
huge team. It is a multidisciplinary team that is required. And that emphasis and that need and requirement is the focus of World Kidney Day. And the actual catchphrase in terms of World Kidney Day 2024 is equitable healthcare or kidney care for all. And I think that's the biggest thing that's actually come up through the years. When you look at the position paper in terms of what World Kidney Day means and why it was actually taken so seriously, it's small stats, and I want to just tell you and share with you a few bits of information. There's about 850 million people around the world that have been diagnosed with chronic kidney disease. Of that 850 million people, 20 million people succumbed or died as such in 2023 related to chronic kidney disease. Whether or not they had access to medical care is unknown. And with that number of patients, the proportion of nephrologists and kidney specialists to 1 million patients is 12.
Oh,
Now, if you look at that proportion, it's physically, humanely impossible for those 12 people to provide adequate healthcare to 1 million people.
Yes.
So in order to actually bring this level of care to patients, we rely on a whole host of people. Primary care physicians are very, very important, together with general nursing care and any healthcare facility. That's the first port of call for patients. Identifying the problem is probably the most important thing.
yes.
Because kidney disease is often silent. And the problem is that by the time they get to me, which is the end pathway, patients are already far, the kidney disease is actually far accelerated, and there's very little we could do to reverse it and to improve it. And we're trying to bridge that gap. And that's also the other aspect of World Kidney Day, is filling the gap and minding the gap in terms of bridging the difference between those who have healthcare access and those who don't, and trying to make sure that chronic kidney disease itself is a focus of everybody, and that education to the communities is what actually creates this, prevention strategies. Those are things that we're actually focusing on.
The stats that you mentioned, that was post-COVID era. So a lot, this just goes to show people didn't seek healthcare advice or healthcare at that time as well. And that's what it resulted in.
Well, I think COVID aside, this is healthcare just in general in terms of chronic kidney disease,
Yes,
because
that's what I mean, yes.
the biggest cause of chronic kidney disease worldwide is uncontrolled diabetes. It's uncontrolled hypertension. It's these common things that people think are not creating a problem, that perhaps you've gone to a cardiologist who's the heart specialist, and you've checked your heart and you're really, really comfortable that there's no problem with the heart. And the problem is that there are multiple organs that are affected. And because kidney disease is silent, it's often neglected to the point where it's picked up very late. And I think that's the sort of reason why World Kidney Day is so important for kidney specialists. It's to bring awareness to the community so that we can start picking up cases a lot earlier, rather than allowing them to progress to failure.
Yes.
Because we do not have any more capacity in dialysis units. It's going to become really, really a much bigger problem. It's already an epidemic as far as we're concerned. And dialysis units are managing, but there's a 10% increase in dialysis units from 2019 to now. And if you're looking at it, it's something that is not going to be sustainable
Yes,
for
it's not enough.
healthcare in the long run, because it's a really expensive condition to have, unfortunately. It's a luxury to have access to healthcare.
Yeah.
And it's something that I often say to my patients, that you're fortunate. Yes, you may be unhappy that this has happened to you. Nobody ever chooses kidney disease. No one chooses any medical
Yes.
ailment, to be honest. But you have to look at the positive aspect of it, that you have access to healthcare. Because if you didn't, the alternative was doctors used to say, well, unfortunately, there's nothing more we can do for you. We'll keep you comfortable. And patients were not given any treatment.
Yeah.
And most countries, low-income countries, this is the majority of patients. They don't have access. We're fortunate, and a lot of patients are fortunate that they do have access to medical care and that they can get therapy that is required. But again, the ultimate goal is prevention. You don't want to get to the point where you even need
Required
therapy.
treatment, yes.
And that's really the idea.
Yes, and the advice and the education must come from experts, not from Google. So,
Of course, absolutely.
You've had a very busy day today with education. I think you've been starting from the morning up until now when you got
So
here.
Prabhashini, I must tell you, World Kidney Day and the dialysis units, my hospitals that I work in, they've actually done such amazing work today. They've managed to take the message to communities. We were at,
A mall.
a mall, and we managed to screen patients for free, blood pressure checks, sugar checking, and just information. And it's important that people see us as well.
Yes.
12 per 1 million is an impossible task,
Yes.
but when we can, we do try and reach out so that people are aware that there is this need and that we can help and that they need to take responsibility
Yes,
and
first
try
and
and do as
foremost.
much as they
Yes.
can so that they arm themselves with information. And that's what I say to patients, and I see in my practice as well. Arm yourself with information. Information can never ever let you down.
Yes.
Know what it's all about, understand what your body's actually risk factors are in terms of being a diabetic patient. Have tested, have you had your bloods tested? If you haven't, insist on doing it at least for the first 5 years of diabetes. If you're badly controlled, you need to have those tests done because you are not going to tell otherwise. The signs of kidney failure are so subtle. Sometimes they can even fox the most experienced of clinicians.
Yes.
And I think without our added investigation, you're not going to be diagnosed. And that is the patient that's going to progress and nobody's going to know about it. And
Yes.
this is the patient that will land with me and we'll end up saying, unfortunately, there's nothing we can do and we're going to have to start you on dialysis. And then your whole world changes. It's a complete, it's a very difficult condition to accept because it's a life-changing event.
Yes.
It changes your entire life moving forward because dialysis itself doesn't stop because your kidneys do not regrow.
Yes.
Nothing recovers the tissue. You've got to have something to replace the function, and that is what dialysis does.
Your job sounds so much more worse than mine.
That's a very, very interesting thing that you said. Worse, because I deal with patients who feel like they have no alternatives, but also positive because I can give them an alternative.
Yes.
And this is also something I say to patients, and I'm going to share it with you now as well and with the listeners, is that when you have kidney failure, there is therapy that can actually help you. When you have heart failure to the point where your heart's not working very well, there is no machine that can replace the function of your heart.
Yes.
There is no machine that can replace the function of your brain. The kidneys are such a beautiful pair of organs that they are so forgiving.
Says
And
the
I'm
nephrologist.
biased. And I'm biased. And I'm going to say that because I'm biased, right? But I mean, look at it. At the end of the day, you have an organ in a body that's supposed to be functioning like every other organ in the body.
Yes.
It's not working. And here you have a machine that can remove the toxins, remove the water, do the job of your kidney.
Yeah.
And patients can live a relatively good, normal
Normal-ish
life.
life, yeah.
Normal in inverted
And there's
commas,
two,
obviously.
and you can live with one.
Well, that's interesting because that's also a question that comes up very often. And I'm sorry, we're just moving to question.
That's fine. Go ahead, that's fine.
But a lot of patients say to me, but doc, are both my kidneys affected? And the sad thing is that obviously when you come in with a blood test that shows that your kidney function is poor, your kidneys have done everything. Even if it was one carrying the weight of the other, it's eventually come through and it's a amalgamation of both your kidney functions. Essentially, it is an average of both.
Yeah.
It is not one kidney and the other kidney spared. No, because you really don't need two kidneys. One kidney can do the function of both the kidneys. That's how a transplant works.
Yes.
Yeah.
Okay. So let's get into it now proper, right? We need to know from you, for the listeners, what actually causes kidney damage.
Okay, so there's various causes of kidney disease, but if I'm going to be just general in terms of the causes, because it could be quite technical, it could be acquired conditions, you could be born with certain conditions, inherit certain conditions, abnormalities in the actual size of the kidneys, you have cysts in the kidneys that can eventually lead to kidney failure, but you also have infections that can actually do that, hepatitis, HIV, these are conditions. But the most common causes of kidney failure in developing countries and around the world is hypertension, diabetes. Diabetes is the biggest cause of kidney failure. And it's not just diabetes, it's badly controlled
Yes.
diabetes. So
Because
there's
diabetes isn't a death sentence.
no, it isn't. And I think that's the thing that most people don't see.
Yes.
And I think that's also something that needs to be focused on. And I'm sure you're doing great work with that in terms of educating the listeners about
Absolutely, yeah.
diabetes. But because diabetes itself is an abnormality of glucose control, and the glucose itself has an abnormality in terms of the way the vessels are actually now functioning, and that causes changes in the filtration of the small little units inside the kidney, and that eventually gets damaged. And because it gets damaged, you basically affect small little components, and eventually the whole kidney is affected, and you end up with a failed kidney. And that's what happens, and that's what causes kidney failure per se. But there's various causes of kidney failure, including drugs, toxins, even trauma can actually do it when you actually injure quite large numbers of quite a large amount of your tissue, and you have something called myoglobin. It's a pigment that actually is released. It can actually cause a form of kidney failure, and that could become permanent if you have underlying kidney damage as well. So I think causes are so wide. The common causes are things that we've already discussed and spoken about.
It's interesting. I remember when I was in States, we used to see a lot of acute renal failure. And the fact that you mentioned some of these things are actually preventable because it was mostly the drug intake and, certain
Yeah, absolutely.
traditional,
Yes.
not so traditional stuff that patients
Yes.
used to consume.
Yes.
And it's so hard to actually recognize until you actually run those blood tests and then you see, this is a sign of acute renal
Exactly.
failure. And those things are actually reversible.
Yeah. So in that case, if you and a lot of patients also ask me about reversibility because remember, patients want to know this condition can get better.
Yes.
And the entity that can get better more often than not is the acute component of kidney damage. So if you've had normal functioning kidneys, you have an acute episode of something going on, and you are treated, that has a potential of recovery quickly. But if you have chronic kidney disease that is slowly happening over years, and you have scar tissue that's now replacing the tissue that's been there, there's called sclerosis, eventually that kidney is destroyed. There's no way you can regrow
Yes.
scar tissue, and that eventually is irreversible. So there is an entity where kidney damage can actually improve, especially if it's acute, if it's related to toxins, like we said, trauma, sometimes pregnancy-related issues can lead to that, and you can recover the kidney tissue, relatively quickly. But again, there is nothing that's guaranteed. There's always a possibility that acute kidney damage could lead to chronic kidney failure, and it just depends on the patient's general health, comorbidities, and the care that they get and how quickly they get it.
Okay. So, in our country, how common would you say are kidney problems? Or I guess even if you want to just use our province.
In terms of common, how common it is, well, there is a national registry in terms of kidney disease, and there's some great work being done from our colleagues down in Cape Town, and one of the professors there has actually got a registry going through, and the last stats, if I recall correctly, and I stand to be corrected, was about 10,000 patients on dialysis in the country.
Okay.
And remember, we're looking at a percentage of chronic kidney disease that progresses to failure.
Yes.
So if you extrapolate that and you work with a little bit of maths, you're looking at patients with kidney damage sitting in the region of about 500,000 or so, and
That is a
even more.
significant
And remember, these are diagnosed.
Yeah.
We don't even know what the percentage of undiagnosed diabetics, let alone undiagnosed kidney patients, out there. And that is why days like today are so important. That is why I'm so passionate about teaching, educating, and getting people to go out and seek, some form of assistance in knowing your kidney status.
Yes.
And previously, there was this entire healthcare agenda about know your HIV status.
Yes, I was
and know
actually
your
thinking about that
HIV
right now
status.
when you mentioned
And
that.
we've just jumped on that and say, well, know your kidney
As
status.
well, yes.
There's every single condition that could potentially affect you. You need to know what your risk factor is for that particular problem. So know your kidney status. Nobody's immune to it. If you're diabetic, you have to go out and get screened. Have a test done at least as a baseline, and then you know where you're working from and what's going on and moving along in terms of your control. And if you're badly controlled, and you will know it, listeners, whoever's listening, if you're having those extra sugary snacks, and you need to make sure that you are checking that your control is adequate and that you do seek, medical help in terms of getting that sugar level control. Because, like I said, in the communities, in the local communities, that is the biggest cause of kidney damage and kidney failure.
Yeah.
And the Indian community, unfortunately, has been terribly affected in terms
Like if they
of
can't see it, it's not there.
yeah, in terms of kidney disease.
Yeah.
If you go into the dialysis unit, the majority of patients that we are seeing these days are the badly controlled Indian diabetics. And we have to, obviously, the reason for diabetes with Indian patients is a totally different topic altogether, but that lends hand in hand in terms of what the target organ damage is, which is kidney failure.
Okay. All right. And, I know you spoke about in terms of curing kidney failure, that it actually would depend on what the cause is and how far into the spectrum of disease that we are. But are there treatments available for kidney failure, and obviously can it be prevented?
So, in terms of treatment for it, it's nice. So kidney damage is diagnosed or with a blood test and a urine test, and once your results are known, you are classified into a different stage of kidney damage. And depending on the stage of kidney damage, your doctor, whoever it is that you are seeing, is going to now put in strategies of trying to help you prevent progression. So the discussion I have with my patients predominantly is how do we prevent progression to kidney failure? And it's an individualized treatment plan for each patient. Together with that, we actually look at risk factors that could potentially be causing the kidney damage, and that involves blood tests and some urine tests, some scans perhaps, and then we get those results, we assimilate those results, and then we plot and plan a treatment plan for each particular patient. So one patient is not like the other in terms of risk profile. So each person has to have a separate plan in terms of how do we plan to prevent progression.
Okay.
Sorry. So if you have, let's say, badly controlled diabetes, I'm going to assess your diabetes control, and I'm going to say to you, sorry, Mrs. N, your sugar readings are not well controlled. Your HbA1c, which is a marker of badly controlled diabetes, is 10. It needs to be below 6.5. Let's work on that because that is what's going to help us prevent progression of kidney disease. A lot of people come to me and say, but doc, where's the treatment? Can I get a pill for this? Unfortunately, the kidney itself doesn't work that way. It's not an infection like a flu where you can get an antibiotic, it goes away.
No vitamins that you can take,
There's
daily
no
drops that you can take to treat your
No,
chronic
there's
kidney disease.
no IVs that you can have as in a booster. The problem is that your kidneys, and I explain this to my patients in the following way. It's like a sink. At the bottom of the sink is a sieve, and whatever you put into your sink is actually being sieved out. And if that sieve is damaged, you have to correct what's going into your sink. So your hypertension, your diabetes, your abuse, and I'm going to say abuse slightly in terms of analgesia, pain medications, all the things you think are really safe that you're popping every day in terms of your
codeine-containing compounds.
Yes, all of these substances and medications that will eventually cause damage to that filter, and that's the problem. You want to try and prevent what's going in because once the filter is damaged, you can't replace it. You can't reorganize the architecture. It is such delicate architecture, and once it's destroyed, it's gone. You can't really do much, and that's when you have sclerosis of that kidney, and then damage, and then function obviously drops in terms of your blood results, and patients go into failure and need dialysis therapy and supportive therapy.
Okay. Just one thing I want to comment on, because I'm glad you touched on it. And you mentioned no IV is going to help your kidney.
Yeah.
However, there are IVs that can damage your kidney as well. Anything can damage your kidney.
Absolutely.
And this is one of my pet peeves, I think, for me, and we've discussed this before, being an aesthetic doctor, especially when patients are using IVs for whatever reason. It's very important that you know what exactly is going into it.
Absolutely.
It has to be pure compounds, and a lot of patients do aesthetic related IVs. And whilst I'm all for that, I do feel that it needs to be responsibly used, because
Agreed.
I have
Absolutely agree with you.
I have seen problems where it's not immediate.
Yeah.
It's further along down the line. And generally, once you get to that point, then they're presenting to me.
Yeah, no, exactly. And you know, and the thing is, it's hard to undo what's
Oh,
already done.
yes.
And I think that's also the difficulty I face as a nephrologist, is that sometimes it's such a pity, because I wish I'd seen somebody a little bit earlier.
Yes.
I wish they had come to me with the same situation, but I could have advised them, I could have helped them, we could have strategized, we could have planned.
Or we could have educated them before the scenario.
I'm not saying that we can prevent everybody from progressing to kidney failure, but at least we could delay it, even if it's inevitable.
Yes.
I think we have to understand that there's certain conditions that doctors can prevent from progressing, and there's certain conditions we can't. We've got to assist you and carry you smoothly towards the end, so that we can help you prepare mentally for what's coming. And the thing that I do with my patients in my practice is that I'm perhaps brutally honest, but I prefer the direct approach and not leaving things unsaid. I think patients need to know, and I think it's important that the person whose body it is affecting is a person that knows and needs to know. Because a lot of the times I see family members who say to me, Doc, don't say anything to my family member, please discuss everything with me. And although I respect that, and I think it's a protective mechanism to try and shield them from the harsh realities of what's going on, it's also not fair, because what happens is that if that patient progresses to kidney failure and needs to go on to, say, dialysis, then they begrudgingly go on to dialysis because they were not prepared.
Yeah.
They didn't know what was going on.
Yes.
And I think it's an unfair thing to do, because irrespective, if you think your family member, whomever it is not mentally strong enough to handle the condition or not, how are they going to manage the actual treatment if you don't give them the opportunity of processing the information?
Yes.
It is so important that we give patients the benefit of the doubt. And there's tools and mechanisms of how we can do that gently, safely. We've got a whole team that I enroll patients into when they come see me. They're enrolled into my renal care program, into my entire renal program. I have a renal manager. We work with dietitians, psychologists. You know, there's an entire team that's now sitting together with them and explaining and helping them through the process, rather than dumping them into the deep end and saying, well, sorry, today you're starting dialysis, you've just got to deal with this, because that's not really
Because mentally,
very
it also takes a toll on them. Counseling is in support is so important.
I mean, and I have to tell you from a personal perspective, when my dad went on to dialysis, and it was a very difficult thing, because I think in terms of preparation, it happened pretty acutely, so there wasn't much preparation involved. And I saw the mental toll it took on him and the rest of the family in terms of managing and handling the condition.
Yes.
And I say this to all my patients when they come to me as well. The spouse that is sitting there listening to what's going on with their husband or wife, and I specifically speak to them to say to them that they need to be very strong, because the brunt of this condition falls on their shoulders. Because unfortunately, there's good days, there's bad days. There's days when the patient doesn't want to get up, is angry, is upset, is so abusive sometimes verbally,
Yeah.
that
They're frustrated.
they're frustrated, they're angry, they're upset about the entire condition, and they're upset with themselves rather than with anyone else in particular.
Yes.
But the person that they take their anger out and vent on is the spouse most often,
Yes.
and yes, the rest of the family. So it can sometimes be such an unfair thing, because here you are as the spouse trying to help the person, and you feel like you're so unappreciated, and you feel like you're so undervalued. And it's such an important thing to have that structure of psychology support for the whole family when
Yes.
it happens, because dialysis is a lifelong condition, and the only cure for kidney failure is a kidney transplant. And I think this is something you have to educate patients when they come through to seeing you, because it's a mental game. You've got to be prepared that this is the long haul. This
Yeah.
is not a short-term thing. Dialysis doesn't happen 2 or 3 times and then you're done and you go home and you forget about it. It's a difficult process that changes your whole life.
You know, I always say this to my patients. I think they need to be involved in their healthcare. They also need to be responsible enough. They need to be aware and responsible for their own health. Nobody is going to actually do anything for you except yourself.
No, absolutely. And I think when I speak to patients about that, and a lot of it is, but doc, I didn't know, nobody told me. So I say to them, but you've been coming to me for 2 years.
Yeah.
I've told
didn't
you. I've told you. I've educated you. When you are not with me, I can't monitor what you eat and what you do
Absolutely,
and how you
yes.
do it. I'm here to guide you. I'm here to teach you, educate you, and take you through the process. But the hard work comes from yourself. And going to the kitchen in the middle of the night when everyone else is sleeping because you're really just craving the thing you shouldn't be eating is not going to affect anyone else but yourself. I think it's such a hard thing to have somebody, sometimes who's not controlled, because most diabetics that are uncontrolled end up with kidney failure, to now expect them to be super controlled.
Yes.
It's probably the hardest thing in the world to ask them to do.
Definitely, especially an Indian patient.
And yes, and especially because every single function we have, every single prayer you go to, every single, social gathering, you have sweetmeats.
Yes.
You have
We
the
love
most
it, Jay.
sweetest things.
And we love biryani.
And everything's made with the absolute richest of ingredients. So, our lifestyles really are difficult in terms of trying to maintain the diet. And that's also important because kidney failure and kidney damage works hand in hand with a diet. And a diet is given to you by a dietitian, a meal plan in terms of your breakfast, lunch, and dinner. And the person who's preparing it in the house has to be formally, discussed with in terms of what has to be prepared, what can be prepared. But also the difficult thing is some families whose family member has kidney failure, they have separate meals, and the rest of the family would eat something else. And now those patients come back to me and say, Doc, but I feel terrible. I feel
Yes.
like I've been,
Ostracized in a way.
ostracized,
Yes.
and everyone's
Needs to be
ignoring and
supportive.
neglecting me.
Team
So
effort as
it's
well.
a hard thing, and in fact, it's a source of huge conflict in homes because food's important to Indian families. And I see husbands and wives fighting when they come to me to say, well, she's not feeding me. Or he's not feeding her, or whatever, it's stopping me from eating. And so I suggest to families, why don't you all just eat the same thing? It's not a bad thing. It may be a little bit of adjustments.
It's going to help everyone in the long run also.
It's going to help everybody in the long run. It also makes the person feel more included. And again, it's the psychological acceptance that's actually needing to be, provided for the patients. They're going to have to, get familiar with what's going on and help the person. I think everyone
Most
altogether.
definitely. Before we cut to a break, we were talking about something very exciting before the show that's happened with you. You want to just share that with our listeners?
Yeah, well, look, I mentioned briefly about the only cure for kidney failure being a kidney transplant. So Prabhashini and I were talking earlier before the show, and I mentioned to her that on Friday I had a transplant with one of my patients done, and it was such a special thing to actually see this particular patient come through at the end of her journey in terms of kidney damage and failure, dialysis, and now being given this opportunity and this wonderful, gift of life, as I say to it, in terms of the transplant. And, I've been so fortunate and so blessed that in the last 2 years I've done 4 cadaver transplants, and my patients have just thrived with it. And, it's such a rewarding thing. Yes, you see quite a lot of desolation and quite a lot of, unhappiness and problems and issues. But when you get to see something like this, a 30-year-old patient getting a transplant after being on dialysis for 10 years, after being with me through the whole process, it is such a wonderful thing to see. I'm actually truly blessed. I feel like the job that I do, it has so many
rewarding.
different rewards, and this is one of them. And to share with patients and with listeners that, there are good, positive stories that can come through from this. And it just is a matter of attitude. It's a matter of how you live your life with dialysis or with renal failure or with renal impairment. It's really so much to do about your attitude. And if you have a positive attitude and if you embrace what needs to be done in terms of therapy, and you don't look for constant excuses to not do what you're supposed to do, things work out. Things can happen. And yeah, it was an absolute pleasure having been involved with this particular patient, and was a nice way to bring in this week and for this month of kidney awareness for me.
Yay, we like happy stories.
Thank you.
So, you guys can send me your questions, your comments, and your own experiences with having been diagnosed with renal disease or insufficiency, and all the challenges that you face if you live with someone who has kidney failure. The number to WhatsApp us or send your voice note to is 074 345 4447. And don't forget to live stream us now on Radio Garden or on Facebook Southside FM South Africa. So I see your questions coming through. Keep them coming through. We are going to discuss them at the end of the show. We have a Q&A segment. But for now, we will be back on your airwaves after this.
Dark child. I like that. My life will never be the same. 'Cause girl, you came and changed the way I want, the way I don't. I cannot explain the things I feel for you. But girl, you know it's true. I'll stay with you, I'll feel my dues, and I'll be all you need. Feels so right, girl. Such the perfect love all my life. All my life. Ooh, feels right. Deep down, see, perfect love. That's right. Come on, girl. My girl, you know you did everything I wanna give. There is no think about someone like you. Come find right, my girl. You know you did everything I wanna give. There is no think about someone like you. Come find time. I knew that love would bring this happiness to me. I tried to keep my sanity. I waited patiently. Girl, you know it seems that life is so complete. I love this you because of you. You're doing what you do. The perfect love I search for all my life. Oh, love that's awesomely so right. Girl, my world, you know you did. Come on, I wanna give the very best love you think about. Come find, you rock my world. You know you did. You rock my world. I wanna give the very best love you think about. Someone like you.
It's Doctor's Corner with me, Dr. Prabhashni Kupsami, Thursday evenings from 7 to 8 p.m. exclusive to Southside FM 107.2. And tonight, I have the privilege of speaking to Dr. Jay Mudley, a specialist nephrologist in private practice right here in Durban. And we are talking about kidney disease and the things that we can do to prevent it. So please feel free to send through your WhatsApps and your questions for Dr. Mudley on the WhatsApp line 074 345 4447, and he will be answering them shortly. So, Jay, for the concerned and the uncertain patient,
Yes.
how will they know if they have kidney disease? What sort of screening tools are available to the patient to test one's kidneys?
So, as I mentioned, the only way you can tell if you have kidney trouble is by doing a blood test or a urine test. But there's certain markers that obviously your primary care physician and team can actually look for. Things like swelling of the legs, abnormalities in terms of breathing, difficulties walking, anemia or pallor as such. There's just various things that actually can come through that you can actually have an idea that you may be dealing with it.
Right.
But also, as I said to you, you need to also have wellness checks. It's not just about sickness checks. And it's something that I use very often in my practice in terms of making sure that you remain well. We actually don't invest enough time in wellness that like we do in sickness. Because the first time you go to somebody or like a medical professional shouldn't be when you are ill and sick. you should also have routine screening. So if you are diabetic, you should know, well, every 2 years I need to have my bloods tested, or I need to have my urine tested, or I've had a cardiac problem before, but how are my kidneys doing? Or, is everything okay in terms of my blood pressure? These are things that you need to keep a record on. Unfortunately, your doctor is not going to be able to do wellness checks with every patient because of the volume we deal with.
Yeah.
But I think it's your responsibility to say, well, am I healthy? What is something? What are the areas that I need to focus on this year or in the next few years? Besides waiting for something to actually happen. And I think it's a term we need to coin, and we need to start pushing forward in terms of the community. We need to do wellness checks, and you need to have those things done routinely. The problem I face with wellness checks are funders. So, you know this. We deal with different medical aids on a daily basis, and they do not budget, many of them don't budget for wellness. There are some big, large funders that will consider certain wellness checks, but they're not going to give you a blanket allowance,
Yeah.
allowance to do anything that you want to. So unfortunately, funding and finance is a huge limiting factor in terms of wellness checks, because they will pay for sickness sort of screening and checks and visits with your doctor, but wellness checks is something perhaps you might have to do on your own. I suggest that if you have a family member with kidney disease and that it's a first degree relative, a blood relative, you should get yourself screened and make sure that there isn't something that is there that is being missed by anybody.
Okay. And also, the whole thing in med school that we learn, prevention is better than cure.
Yeah.
That's baseline. That's baseline.
Absolutely.
I do get patients coming in and saying, Doc, I want a full body checkup. Now, that's so hard for us to do, because if you look at the radiology forms and the pathology forms, it's a whole lot.
Yeah.
So we obviously wouldn't be able to do all of that. But again, it's your GP or your primary care health provider that knows you, knows your family history, and can direct certain screening tests to be done. Because you don't want to be seeing a patient the first time with legs that are so swollen.
Yes. Sometimes I have patients come to me to say, well, Doc, I asked my primary care team to actually perform tests, etc., and they said I didn't need it. And I think it's important for you to also give your doctors a background of why you are concerned. If you've got a family history of it, then it changes the whole scenario.
Yeah.
You need to also explain what's going on, because remember, your family practitioners are also working within a gambit of your funding.
Yeah.
Because they also don't want to create unnecessary expense for you, because you wouldn't be happy with it as well. So
Especially if there's nothing wrong.
Yes. So it works both ways. Yeah.
Okay. So will having a good diet and a healthy lifestyle prevent me from getting kidney disease?
Absolutely. I mean, if you're looking at being unhealthy from a diet perspective, if you're loading your body in terms of your carbs, your sugars, etc., you're going to obviously become unhealthy. And in terms of putting strain and stress on your body, that has long-term effects on many different things. And we can touch on obesity, we can touch on hypertension, and even diabetes. I mean, you've seen the epidemic that's actually happening in first world countries because of access, the sugary overloads, and the youngsters that are now developing diabetes. This is not familiar. It's not coming from genes. It's coming from lifestyle.
Yeah.
And these are things that actually can now increase your risk factor of developing kidney disease, because we just touched on the causes of kidney disease, and diabetes being one of the biggest ones.
Yes.
So, you can actually prevent it by living a healthy lifestyle.
Okay, so I think it's safe to say then that not every diabetic will develop kidney failure.
Absolutely not.
Important. Yeah.
No, good. I'm glad you actually mentioned that, because I think the mistake that we make obviously is focusing on the cause, but not every diabetic will develop kidney disease. Not every diabetic will develop all the complications that come from vascular abnormalities associated with diabetes. It does depend on some genetic predisposition, together with your diet and your control. I think a lot of it's got to do with control. Badly controlled diabetics are going to have all sorts of unfortunate target organ damage and complications, and it just boils down to your control.
Okay. Well, the questions are coming in now, and we need to get to them. So I think I'm going to stop all my questions. I think it's more important to go to the listeners' questions because we can always have you back here.
It'll be a pleasure coming back
to
to you.
complete it. So the last question that I have for you, though, is the most important one. Where can our listeners find you, Dr. J. Mudley?
So my practice is at Gateway Private Hospital in Umhlanga and at Life Mount Edgecombe Hospital in Phoenix. And you can go onto a webpage that I designed. It's www.durbannephrologist.co.za, and that's with 2 N's. And it's a webpage I created specifically for patients, so that you can actually have the luxury of sitting at home and having a look at information so that you can actually now start taking precautions and educating yourself about kidney disease. I think the important thing is that you arm yourself with information, and that was the idea of creating that webpage.
Okay. Did you give your contact number?
My number is 031 537 4125. That's Mount Edgecombe. And 031 492 2111 at Gateway Private Hospital. But I'm sure we can pop some of those
Yeah.
details up on your
Definitely.
webpage.
Definitely. All right, so that brings us to the end of the medical segment. This is Doctor's Corner, my medical show on Southside FM 107.2. Where we are broadcasting live from our studio in Chatsworth. If you have just joined us, we are talking about renal disease as it's World Kidney Day today. We're going to go straight into Q&A now, so you can keep your questions and comments coming through. Let's continue to dispel myths and to reveal facts. So the first one comes from Miss Nirusha Perumal. This was one of my guests on the show. She's a physiotherapist, and she's so naughty. So she says, "Good evening, Dr. Mudley and Dr. Govender." Sorry, Dr. Kupsami. She called me Dr. Govender on the first show, but I think she was a bit nervous.
Oh, yeah.
I forgive you, Nirusha. Okay, so thank you for such an informative discussion. So apt since it is World Kidney Day. And what better audience than the ones listening tonight? How important is diet and exercise for patients living with kidney disease? Since living in a world where patients rely on medication to make them better, what is the relevance on non-pharmaceutical management for these patients? Thank you once again for sharing such extensive knowledge on this topic. Well done to the best nephrologist and the best hostess GP. Continue the amazing work. Regards, Nirusha Perumal. Thank you.
Wow, thank you so much, Nirusha. That's a lovely question. And I think, definitely, there's a huge role for both diet and for exercise in terms of non-pharmaceutical management of kidney disease. Diet goes hand in hand with chronic kidney disease. And I think, specifically, just your protein intake needs to be reduced. And again, a dietitian will help you go through your actual meal and meal plan. In terms of exercise, better living, healthier living, exercise is extremely important. Again, it does depend on the stage of kidney disease that you do have and your tolerance and effort tolerance that you do have. Remember, kidney disease doesn't happen in isolation. Most of the time, we have comorbidities. We have patients with peripheral vascular disease, perhaps amputations. These are all factors that need to be considered. Cardiac disease as well. But again, within your boundaries of what you can perform or you can do, it's definitely advisable to have both a good, proper diet plan with a dietitian and an exercise program where you're actually remaining quite healthy and trying to actually obviously take in as much liquids as possible as well. Water is important in terms of obviously keeping yourself hydrated. These are all important things that are individualized with each patient. So yes, great question and definitely agree with it.
And he's actually brought, I know this isn't a hint, he's brought me a water. It says World Kidney Day on it. It's a hint to get hydrated.
That's a huge suggestion to you. You need a water bottle and a water dispenser in your station, and I think that's something we need to work on.
Okay, then next question comes from Devin Pillay of Silverglen. He says, "Hi, do paraplegics suffer more from kidney problems because we are sitting all the time, cannot walk? I had an accident, spleen removed. Does it affect the kidney?"
Okay, so thank you so much for that question, Devin. So because you are seated more often than not, because of you being paraplegic, it doesn't directly affect your kidney in terms of pressure effects. But I think the fact that a person's paraplegic could actually have other risk factors for kidney disease, like using medications, painkillers, etc. Those are things that may actually increase your risk of developing kidney disease. It also depends on whether or not you are able to pass urine adequately. And if you are not able to pass urine, it can cause an obstruction, and obstruction can eventually lead to damage to the kidney. So it's called obstructive uropathy or neurogenic bladders, etc. These are things that actually come up with nerve damage that actually filters through to the bladder and to passing urine, and that can eventually lead to kidney damage. And in terms of you having had your spleen removed, that doesn't really play a role in terms of having a risk factor independently for kidney disease.
Okay. So Ruben says, morning guys, Rubendri. Oh, sorry. Good evening, doctors. Is kidney disease hereditary, and what options are there for palliative care for patients with kidney disease?
Okay, so yeah, definitely. We mentioned causes of kidney disease is either acquired or inherited. And inherited conditions, there's a vast amount of genetic issues that actually can cause abnormalities. In fact, there's huge arms of medicine directed towards study of those genetic conditions affecting certain parts of the kidney, the podocytes, which is a part of it, podocytopathies, and these are all different abnormalities that affect certain parts of the kidney, and they can result in kidney failure. In terms of palliation, so we would obviously engage independently with each patient, and palliation would be reserved for patients who have no alternative, either financially or a resource perspective, in terms of having access to renal replacement therapy. There's also other entities of patients who have multiple comorbidities, and an active discussion between doctor and patients actually, and family members is entered into, and a discussion about whether or not dialysis is the option for a patient. I have had patients, an 80-year-old patient or 85-year-old, generally my elderly patient, that say to me, I've lived a long, happy, healthy life, and now that I've got kidney disease, I do not want to go on to dialysis, and I have to respect their wishes. It is their wish to essentially, not be on dialysis because they view dialysis as being really, very difficult for them, and they don't really want to continue. They wouldn't want to start dialysis. So we keep them comfortable. We monitor fluids. We monitor their blood pressure, manage their diabetes or whatever other risk factors they have. And if patients become unwell, we bring them into hospital. And palliation and palliative care is an entire arm of medicine completely. But just to briefly explain, we do not stop treating patients who require palliation. Is a type of medical treatment that just doesn't engage in active therapy discussed and agreed upon between patient and doctor.
Okay. Vanakkam, Dr. P and Dr. Mudli. Vanakkam, Rubeshni. My mom's 72 and she's been on dialysis since 2020. The last year has been very challenging. Kidney function has improved, but her emotional and mental state has deteriorated drastically. Sorry to hear that. Are there support groups to help patients and families going through the same? Thanks.
So, good evening, Rubeshni. I think you've probably hit on a nail that probably affects every single dialysis patient I've ever treated, in terms of having, mental aspects of accepting the condition, and mental state deterioration is not an uncommon thing at all. And I think the most important thing is for you guys to be there as a family and to support her. Again, professional help will be great, and if you could possibly get it from your doctors that are involved in mum's management, it would be something that you should consider. Psychologists and psychiatrists, medications could assist, but I think the majority of the cases actually would require family intervention and family therapy, just to sort of support the patient in terms of their mental anguish and the acceptance, and perhaps preparing for whatever possibilities or complications that may come through. I think the idea, obviously, is to just provide that support base so that, these conditions are openly discussed. I find that, Prabhashini, that when we don't discuss and talk openly with patients, these things actually arise.
Yeah.
Especially when it is the wish of the patient not to do anything. I think families need to agree together as to what the pathway should be.
Definitely.
Because when you say, but no, mum is doing this and mum is doing that, and I find that's when patients rebel against therapy. And when you don't accept therapy, it becomes an absolute torture to come in for dialysis. Everything goes wrong. I think I've seen that, and you've seen that as well. Your mental
Mindset is very
health
important.
and your mindset makes such a big difference in terms of how your dialysis actually progresses.
Yes, definitely. Okay, so does using a catheter daily affect the kidney long term?
No. So I think this is an important question. I think it's coming from Devon again. We've addressed the paraplegia issue, but and I did mention to you about neurogenic bladders, etc. In fact, using a catheter will actually help and prevent obstruction and pressure effects that could damage the kidney. So in fact, this is actually relieving and preventing long-term kidney damage if it is related purely to the obstruction.
Okay. So there's a comment here. Good evening, Dr. Kubsami. Firstly, I would like to commend you on enlightening us with matters relating to health on a weekly basis and say thank you for a great show. Thank you. I'm glad you appreciated. You are welcome. I had the pleasure of visiting Dr. Jay Mudley this week with regards to my personal health, and I must say that he has left quite a lasting impression of being not just a doctor, but a remarkable person. That I can definitely attest to. I know him for some time now.
Thank you
From the
for
moment
that.
I walked into his consulting room, I felt genuine care and concern from Dr. Mudley, which made me feel really comfortable as a patient. I have no doubt that I've chosen the right nephrologist, I don't know that either, to guide me back to a healthier lifestyle and better health. Thank you so much, Dr. Mudley, Mrs. N. Appulsami. That's such a
Thank
lovely
you.
comment
That is
for
such
you.
a heartwarming comment.
Yeah.
And it's such a validation for the work we do. I mean, you need to hear that sometimes.
Yes,
And
that-
thank you so much, Mrs. Appulsami.
We
It's
appreciate,
really, really appreciate it.
the sacrifice. 15 years after high school. Vanakkam, Dr. P, wishing you a blessed Thursday evening, and the same to you. Thank you for always keeping us informed on the various health issues that we face on a daily basis and bringing specialists in their respective fields to give us information on how to deal with what we may go through. Big ups to you, and may the show grow to new heights. Stay safe and stay blessed. Thank you very much.
What a wonderful comment.
Lovely
now,
comment.
Now, this is something for your validation in terms of what you do. So I don't know if you hear this often enough, Prabhashini, but I need to say this on air for all your listeners to hear. So I also know Prabhashini for a while, and I know where she comes from and what her drive is and what her passion is. And I can actually, I need to commend her with the work that you're doing and the education you're giving to the communities. What this is actually doing is uplifting people, and education is the only thing that's going to break the cycle of constant pain and misery in terms of healthcare.
Yes.
We want to not see patients sick. We want to
Yes.
see them get better. We want to see them prevent disease. And this is how the first worlds are actually treating healthcare.
Yes.
And I'm so glad that you've got the show. And I can
thank
only,
you.
yeah, no, I can actually commend you. And Dr. Skwana must grow from strength to strength. You're doing brilliant work, and you're doing excellent, education series for patients. And it's great seva, as we mentioned before.
Thanks. I think, part of our success lies in watching our patients get well. That's where our success comes from.
Absolutely. I think people don't, or patients don't realize that it's almost a personal, validation when patients are doing better. And it actually,
It's a good feeling.
it is. It actually perplexes you when things are not going right, even though, medicine is only so much that you can do with medicine. I mean, you've trained and you use everything you can to help somebody.
Yes.
But sometimes you can't do any more than you can do. But when those positive things that, you've trained to do help patients, it's a wonderful feeling.
No, it really makes
It
it all
is
worth
wonderful.
it, definitely. Okay, we've got a few more here I'm going to go through quickly. Okay, so this... traveling whilst on HD. Good evening, doctors. Good evening. Yes, we had a bit of a problem with the radio frequency, the FM, today because of the network. I'm not sure, but I hope you guys have been live streaming on Radio Garden and watching us on YouTube and on Facebook Live. So, Namaste, doctors. Can one travel abroad whilst on dialysis? This is a very important question.
And this is a question that I think we must talk openly about. I hope your doctors actually explain to you that you can. Dialysis is worldwide. There are centers around the world that actually have dialysis. What you need to do is decide where it is that you're going and whether or not the country actually will support you with your medical aid itself, or whether you need international traveling insurance. Sometimes it's a cash transaction that you have to engage in, but it has to be factored into your traveling. I have patients that have traveled to Mauritius, to India. They all offer therapy. You go across with your doctor's information sheet in terms of your medical health, your dialysis prescription. All of these things get taken across to you, to your facility, and they just initiate therapy. You have to make sure that where you go to is an accredited facility, that the infection risk is not there, and that, obviously it's quality centers. I wouldn't advocate you using, just backstreet centers.
yes,
There
we've
are
spoken
lots
about
of
this
those.
so many times.
Yeah,
Yes.
there's lots of these around the world. So do your investigation, do your research, and get the right information. Your doctor, unfortunately, cannot tell you where to go. As much information as I know, I'm not a travel expert, and I do not know where dialysis centers actually are around the world. It is your responsibility to please research and come back to your doctor and say, well, I've chosen this area because this is where the center is, and I'm going to go for my dialysis at least twice in the week instead of 3 times. But you talk, you engage, you discuss, because there's no right or wrong, answer to this as such. It depends on patient. And some patients can't travel. If you're really critically ill, you've got to understand that your airline is not going to actually allow you to travel being so unwell, requiring oxygen, etc. There are various rules and restrictions, and you've got to find these out with your doctors as well if you can travel, and with the airline if they can support you traveling.
Okay, that question was from Rakesh. I hope that answered your question, Rakesh. All right, and then there's one more here. Hi, doctors. Thank you, Dr. J. Mudley, for assisting, educating, and supporting my mum on her dialysis journey. Much appreciated, Tracy. The people know you're here, too.
Okay, I'm really surprised, but yeah, thank you so much, Tracy,
Thanks,
and it's
Tracy.
only a pleasure.
And she's a first-time commenter. So, Tracy, I hope you're going to continue to listen to our radio station.
Of
And
course.
you're going to be more interactive in all our shows. Okay, so we have now come to the end of the medical show on Southside FM 107.2, the fastest-growing radio station in KZN. I sincerely hope you enjoyed the topic and discussion. So you can tune in again next week, same time, same place, for another informative hour on all things medical with me, Dr. Prabhashini Kupsami. I want to thank Dr. J. Mudley for sharing his time, his priceless advice, and knowledge with us here at Southside.
You're
We
welcome.
greatly appreciate you being here tonight with us.
Thank you so much for having me here.
So, in summary, just maintain a healthy lifestyle and optimize all your vitals. If you are craving unhealthy food, just stay strong, because that craving too shall pass, just like a kidney stone. That's it for this evening. Next week on the show, I will have
Lots
in
of
studio.
pain.
Lots of pain. Next week on the show, I will have in studio with me audiologist Mandy Play, and we will be discussing hearing disorders. My parting shot for today: life may not be the party we'd hope for, but whilst we're here, we should dance. Thank you for lending me your ears. From me, Dr. P, remember, the best foundation you can wear is glowing, healthy skin. So until next week, good night, God bless, and have a fantastic weekend.
Halamati Habibu, Halamati Habibandale, Halamati Habibu, Halamati Habibanda, Halamati Habibu, Halamati Habibandale, Halamati